All right, let's get right into it. Today, we're going to talk about one of the most common, but somehow still overlooked, reasons you might feel totally wiped out: iron deficiency anemia. And we're going to break it all down through a real-world story that, well, it might just hit a little too close to home for some of you. Does this sound familiar? That kind of tired that feels like it's deep in your bones? The kind that no amount of coffee can seem to touch? Or those nagging headaches you just blame on a stressful week or a bad night's sleep? It's so easy to brush this stuff off, right? But these could actually be your body trying to tell you that something more is going on. So to really get a grip on this, let's walk through the story of a real patient. For our purposes, we're just going to call her AS. So meet AS. She's 31, and she works the graveyard shift, which, is tough enough on its own. She tells her doctor she's just constantly exhausted, plagued by these headaches, but she's already decided it's just her crazy schedule. I mean, who wouldn't think that? But her doctor notices something else. She looks pale, and her energy is just flat. And that's the trigger. That's when the real detective work begins. Okay, so where do you look for answers when the problem is invisible? You got to go inside. You look at the blood, and this is where a simple lab test starts to tell a much, much deeper story.
And boom, there it is, the first big clue. AS's hemoglobin level is 8.2. Now, just for some perspective, a normal level for a woman should be 12 or higher. So 8.2 isn't just a little low, that is a huge red flag. And it's basically screaming that her blood isn't doing its number one job, carrying oxygen around her body.
So, what do we call this? This points straight to anemia. And all that really means is that your blood doesn't have enough healthy red blood cells, or more specifically, the hemoglobin inside them. Think of hemoglobin as the little oxygen delivery trucks in your bloodstream. If you don't have enough trucks on the road, the oxygen doesn't get where it needs to go. And what happens then? You feel exhausted, you get headaches. Suddenly it all starts to make perfect sense. But anemia is still a pretty big umbrella. The lab work dug deeper and found her red blood cells weren't just low in number, they were also too small. This is something called microcytic anemia. And when a doctor sees that, what's the number one suspect? By far, it's iron deficiency. And that can happen for a bunch of reasons. You're not getting enough iron in your diet, your body isn't absorbing it right, you're losing blood somewhere, or your body just needs more of it, like during a pregnancy. So we've found the culprit. Now we get to the good part, the solution. The mission here is pretty simple, really. We need to rebuild the body's iron supply so it can get back to making healthy red blood cells again. Now, to get why the fix works, you have to know about this process called hematopoiesis. It's a mouthful, but it just means making new blood cells. The easiest way to think about it is like a factory. This factory runs 24/7, cranking out new blood cells. But like any factory, it needs raw materials. And for red blood cells, the single most critical mineral is iron. No iron, no production. The whole assembly line just grinds to a halt. And here's something wild. Our bodies are actually kind of inefficient at this whole thing. When you eat iron-rich foods, you'd think your body just soaks it all up, but nope, we typically only absorb about 5 to 10% of it. And your stomach acid is absolutely crucial here. It helps get the iron into a form our body can even use. So it's just that tiny little bit that gets put to work building all the hemoglobin we need. So for AS, the game plan is all about getting her more absorbable iron. Her doctor prescribed ferrous sulfate. It's super common, it's inexpensive, and it works. But here's the pro tip. Take it with vitamin C, because that actually boosts absorption. And just as important is what not to do. Avoid antacids. They neutralize that stomach acid we just talked about, which can totally stop iron absorption in its tracks. Okay, treatment has started. The raw materials are being delivered to the factory. So the big question is it back online? Let's check in on AS and see how she responded. And wow, look at this. The results are pretty dramatic. In just 3 to 4 weeks, her hemoglobin jumped from that concerning 8.2 all the way up to 10.2. Her hematocrit, that's the volume of red blood cells, is climbing too. And you can even see that her cells are getting bigger, heading back towards a normal size. This isn't just numbers on a chart. This is proof her body is finally getting the oxygen it's been starving for. This recovery timeline is pretty typical. The body's factory starts kicking back into gear within a week or so. You'll see hemoglobin levels start to tick up in a couple of weeks, and usually things are back to normal in about 2 months. But, and this is a really big but, treatment doesn't stop there. It is crucial to continue for another 3 to 6 months to completely restock the body's iron bank, its reserves. Now, iron therapy can be a game changer, but let's be real, it's not always a walk in the park. It's really important to know about the common side effects and one very, very serious danger. Okay, so the number one complaint with iron pills is that they can be rough on the stomach. We're talking nausea, constipation. It affects up to 20% of people. Oh, and here's something everyone should know. They will cause black stools. It's totally harmless, but it can be pretty alarming if you aren't expecting it. The best advice? Start with a low dose and take it with food to help your body get used to it. And this next part, I really can't stress this enough. While iron is a vital nutrient, it is also highly toxic in large doses. And for children under 6, an overdose can be fatal. 20% of kids who present with iron toxicity die. These supplements have to be kept safely locked away, far out of the reach of any children. So, what happens when someone is doing everything right, they're taking their iron, but their numbers just aren't getting better? What could be going on? Well, the most common reason is simply that the person isn't actually taking the pills, usually because of those side effects. But other things could be at play, like an absorption problem, or maybe there's ongoing blood loss that's just outpacing the new iron coming in. Sometimes it could even be that the initial diagnosis was wrong, or that another health condition like kidney disease is interfering with the whole process. For patients who run into any of these roadblocks, there is another very effective option, one that bypasses the digestive system altogether. This is what's called parenteral, or IV iron, and it's reserved for specific cases. This is for people who just can't handle the side effects of pills, or those with conditions like inflammatory bowel disease that prevent absorption. It's also for patients with anemia so severe that they need to get their levels up and fast. And it's a very common treatment for people with chronic kidney disease. Things like Venofer or Ferrahame deliver that iron directly into your bloodstream. It's like a special delivery straight to the factory floor. It completely gets around any issues with your stomach or intestines, making sure the body gets the raw material it needs to start making hemoglobin right away. And that brings us to maybe one of the most important questions you can discuss with your doctor once your levels are finally back where they should be. There are really two schools of thought on this. Some doctors will stop treatment as soon as your hemoglobin is normal and kind of use the anemia coming back as an alarm bell, but others prefer to keep going for another 6 months to completely fill up the body's iron reserves for the future. But ultimately, the real takeaway is this. The goal was never just to fix a number on a lab report. It's about restoring your energy, your health, and your quality of life so you can actually feel like yourself again.